Here I am to talk to you about 12 bad habits that can destroy your kidneys. So have you ever wondered if your behaviors were harming the health of your kidneys? Did you know that some habits that you think are harmless can be causing a lot of damage? So in terms of leg swelling, tiredness, urinary changes, all this can be a kidney problem. And kidney disease is silent and only growing in the world. So around the entire planet Earth, about 800 million people have chronic kidney disease, and it's a silent problem. And in the United States, to give you an idea, 1 in 7 people have chronic kidney disease, and many of these people don't even know they have the problem. So more than half of the people who are undergoing hemodialysis, which is that procedure that is done in the hospital or in some clinic to remove excess water from the blood, to do the kidneys' function of filtering the blood in those people in whom the kidneys no longer work. So more of the people on hemodialysis only find out about chronic kidney disease when the kidneys have already stopped working. So we have to pay close attention to the signs and symptoms. That won't be the topic of our video here now, but we have to understand how to prevent and what to do to avoid developing this problem. Because here in Brazil, to give you an idea, about 10 million people have some degree of chronic kidney disease. And to start, we have to talk about the kidneys. What are kidneys? They're organs that are located here in the thoracic region, in the transition from the thoracic spine to the lumbar spine, and they're shaped like beans. And the kidneys' function is to excrete end products of metabolism and also to excrete excess water. To give you an idea of their relevance and importance, about 20% of cardiac output passes through the kidneys per minute. So every minute, every 60 seconds, 1.2 liters of blood pass through the kidneys and are filtered by the kidneys in a resting adult. But what habits are these, folks, that can destroy your kidneys? And the 12th habit is excessive salt consumption. Because the excessive consumption of salt, of sodium, it increases blood pressure. It also increases water retention because your body, when it has too much sodium, it will retain water. It will not dispose of the water to be able to dilute that sodium, to reduce the concentration of that sodium. And all this ends up compromising the blood vessels present in the kidneys, and the kidney ends up losing the ability to filter waste and also maintain fluid balance. So in addition, excessive salt and sodium consumption also contributes to oxidative stress and inflammation, which will damage kidney tissue. We always talk about oxidative stress and inflammation here and how important it is for us to fight these problems. In addition, excessive salt consumption is associated with the development and also the progression of chronic kidney disease. The 11th habit is inadequate hydration, because when you drink too little water and when you're dehydrated, there is a reduction in blood flow to the kidneys. So this happens because of a reduction in total blood volume. So our blood has a lot of water. If you're dehydrated, your blood will have less water. And with this lower total blood volume, the kidneys end up not getting the proper amounts of oxygen as well as nutrients. And this increases the risk of kidney stones, also known as nephrolithiasis, and also increases the risk of infections. Dr. Joao, how much water should I drink? Folks, if you don't have any contraindications to drinking water, what are the contraindications? Kidney disease already at a more advanced stage, a more severe kidney disease, or a more serious heart or congestive heart failure. This will contraindicate the consumption of water in the standard amounts for everyone, which is the amount of 30 milliliters per kilogram of weight. So if you have 50 kilograms, you should drink 1.5 liters of water. If you weigh 80 kilograms, you should drink 2.4 liters of water. That's the math. For every kilogram of weight you have to drink 30 milliliters of water, given that you don't have a contraindication. The 10th habit that will destroy your kidneys is to eat too much sugar, because this will increase the risk of type 2 diabetes, which will damage the blood vessels of your kidneys. In addition, high sugar consumption increases the risk of obesity, which creates kidney overload due to insulin resistance and also inflammation. What does obesity usually go hand in hand with? High blood pressure. And in addition to that, the high consumption of sugar will contribute to the development of what we call advanced glycation end products, which build up in kidney tissue, create inflammation, create oxidative stress, cause kidney damage, and cause a reduction in the function of the kidneys, an impairment of kidney function. So folks, let's control our sugar consumption. Let's avoid soft drinks. Let's avoid sweets. Let's avoid candy. Let's cut down on our sugar intake. Let's avoid putting too much sugar in our coffee. Good? Agreed? The 9th habit is the use of NSAIDs, the non-steroidal anti-inflammatory drugs like ibuprofen, ketoprofen, nimesulide, diclofenac. All these non-steroidal anti-inflammatory drugs work by reducing the production of what we call prostaglandins. And indeed, one of the consequences of that is that there will be a reduction in blood flow to the kidneys, in addition to being a stimulus for sodium retention and for water retention, leading to an increase in blood pressure, which is harmful to the kidneys. So, non-steroidal anti-inflammatory drugs, these medications, they should not be used for more than 5 to 7 days at most. Or if you've been taking diacetyl for a long time, nimesulide, ketoprofen, ibuprofen, diclofenac, cataflan, alginac, all these medicines can't be taken in the long term. They have a beginning, a middle, and an end. And the middle and the end are quick. You can't take non-steroidal anti-inflammatory drugs for more than 7 days because it can damage your kidney health. I've seen patients waiting for transplants because of the indiscriminate use of these medicines. And the problem is that these medicines are sold without prescriptions. Consequently, people self-medicate with much higher doses for far longer than necessary, creating an impossible situation. So let's refrain from using these drugs for lengthy periods of time. The 8th habit that harms your kidney is smoking. Smoking will cause vasoconstriction, limiting blood flow to your kidneys and impairing their function. What we mentioned, when less blood reaches the kidney isn't nourished, it doesn't get oxygen, and the kidney structures are damaged. So smoking increases the risk of chronic kidney disease and also increases the risk of proteinuria, which is an indicator of kidney damage. Why? When your kidneys aren't working right, they can't filter well, and then they'll let proteins that should have been filtered pass into the urine. And then when you check the urine, it will have much more protein than it should, indicating that the kidneys aren't filtering properly. The seventh habit is consuming too much alcohol, because this will increase your risk of high blood pressure, and it will also cause direct toxicity to the kidney tissue because of a substance called acetaldehyde, which is a byproduct of the metabolization of alcohol in the liver. Moreover, alcohol has diuretic properties that lead to dehydration. Why is that? Because when you have a beer, you constantly need to use the bathroom. That's because alcohol suppresses the antidiuretic hormone. So by inhibiting the antidiuretic hormone, it facilitates diuresis. So you pee more than you should. It'll produce a slightly less concentrated urine. Understand? Because the role of the antidiuretic hormone is specifically to concentrate the urine. Then once you are dehydrated, there will be a decrease in blood flow to the kidneys once again, and this will impair kidney function. In addition, heavy drinking also upsets the body's electrolyte balance and also increases the risk of acute kidney damage. The sixth habit that will damage your kidneys is a sedentary lifestyle, because this will also reduce renal blood flow and will increase your risk factors for chronic kidney disease like high blood pressure, diabetes, obesity. So you have to be physically active. We always say that during our live streams. I think I say this every day here to you about the importance of doing physical exercise. As long as it's a walk even, it's better than staying still, sitting, lying on the couch, watching my YouTube videos all day, okay? The fifth habit is not treating urinary tract infections correctly. So when you have a lot of urinary tract infections, there's a risk that the infection will come out of the lower part of your urethra and move up to your bladder, then into your kidneys, causing what we call pyelonephritis. And recurrent infections can become chronic, long-term, and also permanently damage the kidneys, increasing the risk of chronic kidney disease. More than that, recurrent infections increase the risk of vesicorectal reflux when your urine flows back into your bladder, and this increases the risk of another condition called hydronephrosis, which is the swelling of the kidneys due to the accumulation of urine. The fourth habit is excessive caffeine consumption, because caffeine also has a diuretic action and can contribute to dehydration and can also contribute to high blood pressure spikes, which will also harm your kidneys. And more than that, coffee is also rich in oxalates, which increase the risk of kidney stones. The third habit that should be avoided is poor diabetes control. So high blood sugar, hyperglycemia, as we've talked about before, harms kidney health in the same way as the second habit, which is to control blood pressure poorly. And the first habit, which is an unhealthy diet, will increase the risk of diabetes, obesity, and hypertension. So folks, if you want your kidneys to be in top condition, running at full throttle, you should avoid these 12 habits, okay? You've seen here that all of these warnings, all these habits are directly related to your lifestyle. Being sedentary, your diet, diabetes, high blood pressure, drinking water, excessive caffeine consumption. So your habits have a direct influence not only on your kidney health, but also on the health of your entire body. So if you want to learn about the best habits to implement in your life, if you want to learn how to better control your diabetes and your high blood pressure without medication, without tests, without doctors, I recommend that you read my book, The Code of Longevity, Without Habits to Live Over 100 Years. Because the habits that are in the book will help you to prevent kidney problems, to prevent chronic kidney disease. So click now on the first link in the description or on the pinned link in the comments and get your longevity code right now, which I'm absolutely sure you will love reading. And if you don't like it, no problem. You have an unconditional guarantee of satisfaction. If you don't like it, tell me. Send me an email and the team will prepare your refund without bureaucracy and without question.